your organization wants to take the position that there was no way that that information was compromised, and then you need to defend that against, to the government, sort of in a Monday morning quarterbacking scenario, which most organizations don't want to do. Okay. So we're going to quickly look at the sources of cyber liability for healthcare organizations, and this applies to your largest healthcare delivery system, your largest HMO, down to your smallest long-term care, assisted living, or dental practice. Every organization that's a covered entity providing healthcare services in any respect is liable under the HITECH Act. There's also state laws in 46 out of 50 states right now have their own particular state data breach law that runs right alongside with the federal law and needs to be looked at contiguously with the federal law whenever there's a data breach in terms of all of the notification and legal ramifications that will impact the organization. So it's very important that there be not only insurance coverage with good referral resources, but good attorney panel counsel availability as resources to guide the organization when there's a data breach. And the fact that now there are significantly higher potential penalties for a data breach is part of the HITECH Act, and we'll talk about that in a little more detail in a minute. We're going to go through some recently reported healthcare breaches, both in the larger healthcare space as well as the smaller healthcare space. And then I'm going to give you some best practices to put in place before the inevitable breach happens at your organization. It's really not a matter of if, but when. And the government recognizes that everyone's going to have a breach probably at some point. What's really going to separate the wheat from the chaff in terms of who gets fines and penalties and who doesn't is going to be how well prepared your organization is before the fact, and that you can show the government that at the point of a breach, all the things you had in place to try to mitigate a breach from happening and or to deal with it timely and appropriately when you were aware that a breach happened. Okay? So this slide just gives you a technical chronological outline of where the legal rules have evolved from health reform, the HITECH Act, amends HIPAA, and then the final rule is released in January that applies not only to covered entities but also to their business associates, so their third-party vendors and service providers that touch the PHI for their patients, so whether that be third-party billers, storage facilities, etc. They all have 180 days to come into compliance as of January, which now it was the end of September. So now all covered entities and their own business associates are liable for breach of the final rule. So in terms of fines and penalties, everybody